Good morning, everybody. Thank you so much. We apologize for the extra exciting music this morning as we're trying to get our technology worked out here at the Welcome Center. My name is Sarah Wassinger, and I'm President and CEO at the Chamber, and we are very excited again to have the opportunity to have Jason Kennedy. He is the Director of Ellis County Health Services, and he has another update for us this morning. So he'll go ahead and give us some announcements as to the governor's update that was released yesterday. We know that many of you might just be coming on this morning to start your day at 8 o'clock. So we might just talk for a brief minute to give everybody a chance to sign in, and then we'll go ahead and get started with Jason's update. So Jason, we are grateful for your time this morning. So thank you for joining us.
No problem. Good morning, Sarah. Thanks for having us, and good morning, Ellis County. So as everyone kind of saw probably on Facebook last night, the governor did come out with a new phase. I'm not sure any one of us exactly saw this coming, but phase 1.5. So I have not, I just checked again right here before we jumped on. I have not seen the governor's signed executive order with phase 1.5. So I will give everybody a caveat to what we talk about this morning, in that things can still change before Monday. So phase 1.5 goes into effect really Sunday at midnight. I would assume sometime today we'll see a signed executive order from her, which would be Executive Order 2031, and that would be the executive order for this phase 1.5. So we'll talk about phase 1.5, at least as far as what the governor has posted. We'll go through a brief update of our COVID situation here in Ellis County, and then like Sarah said, at the end here we'll have a few questions. So as far as the update for the COVID situation in Ellis County, we actually, for the reopening metrics that the state had posted when we started into the phases 2 weeks ago, the reopening metrics they were going to look at was date since last case, the hospitalizations, and the deaths. So thankfully, with all of those, Ellis County has remained low. We've continued to move forward really in a slow fashion. We haven't seen large increases. And, that is good. That's good for Ellis County. That's good for all of us. So at this point, it has been, we've had no new cases in the last 14 days. Days since onset of the last case, it's actually been 29 days at this point since our last new case. Hospitalizations have remained at 0 for Ellis County residents, and thankfully we've had 0 deaths in Ellis County. Those are all good numbers. Those are great numbers that obviously we want to see continue. As far as contact tracers, the state wants they want to have, I think, around 15 per 100K. We're actually around 60. So as far as the contact tracers go, we are prepared there. Testing rates per 1,000 population, we are at 14.92 as of yesterday. And then our percent of positives. So what that means is the number of your cases, or the number of your tests that come back positive. The state wants that to be under 10%. We're actually 1.9%. So if you take our 8 cases and you put that into the number of tests completed, it's it puts us around 1.9%, which puts us significantly under the metrics that the state wants for moving forward in the different phases. Those are all great numbers. That's something that it's good for Ellis County to keep those numbers low. Now, as we move through these phases and as we look towards the future, I think we would be remiss if we didn't talk about how we move forward with COVID. We could see cases. This is not something, viruses aren't something that just die overnight. Like we talked about, they don't follow the governor's plans. They don't really follow a day schedule. So viruses spread through that human contact. They spread through that close contact with an infected person. Viruses don't spread well through a medium. So what that means is they don't spread well through surfaces or through door handles. I know there's some new information in the news media about spreading in the air. It is conceivable, it is a possibility that this would spread through some airborne droplets. That is how viruses spread, is through airborne droplets. However, it's not, they don't spread well through those. They spread really well through close contact, which is why most of the measures that we have implemented throughout the last 2.5, 3 months stay in place until we have a vaccine. And that is washing your hands and maintaining that 6-foot distance between you and other people. It is conceivable that viruses can transmit through a medium or transport through air, something like that, but they don't travel well for long distances. So 6 feet for greater than 10 minutes is still the best recommendation. Making sure that we implement that as we move forward, as we open businesses, will be extremely impactful for how we move forward safely. So before we even get into the governor's stuff, I would encourage all business owners, whether you are open, close, whether you decide what you look for as your plans moving forward here, making sure that you look at that close contact. So I think as a business, like I said, like I've told you guys before, I don't run a business. I work for the county. So, but in my thought is that I think businesses probably focus a lot on how to protect the customer, how to serve the customer, all those types of things. So make sure as we're opening, as you're looking around your business, making sure that you're doing your part to look at the employee side of things as well, because, I know we might be able to space out the dining rooms, and the governor's plan has looked very hard at how do we space out the dining room, but I haven't seen a lot of good guidance of how do we space out the kitchen? How do we eliminate those close contacts even between our employees? So break rooms, things like that. So I would encourage each of you individually to look at that inside your own business. And like I said, as we move forward, there's nothing in this order that says you have to open. There's nothing in this order that says we are forcing you to open your business or serve anyone. This order is for you to use as a guide. It does specifically say certain businesses that are closed, but if you want to remain closed, or if you want to take your own steps to be a little slower in your opening, that is perfectly fine for you to do within your own business. Ellis County will not issue anything any more restrictive than the minimum of the governor's orders. We do not see any indication to be any more restrictive. And we will meet again Monday night as a County Board of Health to reinforce that. But in conversations, we've decided, and from my office, we will not issue anything more restrictive than what the governor's orders are. So as we look at the plan, like I said, I have not, this is preliminary as far as now until we see a signed executive order from the governor, which I have not seen. But in her on the governor's website, she does have some notes of what the highlights basically of what phase 1.5 will look like. We'll hit those highlights. I do have a preliminary copy, like I said, an unsigned copy of what the executive order 2031 would look like. It's very similar to all the other executive orders in that it does not allow local government to be less restrictive. It does allow us to be more restrictive, but as we've talked, we have no intention to do that in Ellis County. The key highlights from the phase 1.5 that they're talking about is that the real key is that mass gatherings of 10 stay in place. So we had all thought that Monday we would move to a mass gathering of 30. The mass gathering of 10 people stays in place. Now, the definition of a mass gathering. A mass gathering is defined as instances in which individuals are in one location and are unable to maintain a 6-foot distance between individuals, not including individuals who reside together with only infrequent or incidental moments of closer proximity. Now, we've talked about in a restaurant setting. So in a restaurant setting, I see no changes in the new order. You can still have 10 people at a table as long as all 10 of those people know each other or are there together. We can't seat strangers, 10 strangers at a table, and that table would need to be 6 feet away from the next table. And like I said, making sure that it's the person-to-person contact. So just because the corner edge of the table is 6 feet from the other person doesn't really meet the needs of viral transmission. So it's that person-to-person. So making sure if you have people with their backs to each other that those people are spaced 6 foot apart. I think all restaurants are doing that. You guys understand that. That's what we've had. Nothing changes there in this plan from what we've done over the last 2 weeks. So the mass gathering piece stays in place. Nail salons, barbershops, hair salons, tanning salons, tattoo parlors, and other personal service businesses where close contact cannot be avoided can open. So all of those businesses that were closed in phase one are now open. The nail salons, barbershops, hair salons, tanning salons, all of those. So she does put in there, but only for pre-scheduled appointments or online check-in. I would assume that would be fairly easy for you guys to, for all those business owners to accomplish. And I will give you the justification for the appointments and the check-in process is the contact tracing piece. So we've talked in the past about contact tracing, what that looks like, how we walk those steps back if someone does happen to test positive. This is the governor's attempt basically to help that process. So if you do have someone that comes into your business unannounced and they're not going to impact your mass gathering, they're not going to create a situation, just keep track of them. Get them down for an appointment. Make sure that you have that on paper so that if something does happen, hopefully we don't. Hopefully we don't see any viral transmission. Hopefully we don't see that piece. But if we do, we can trace that back. We can make sure that we know who is being impacted. Make sure that as you open your businesses, you don't have a large group, 10 people or not. It doesn't really matter. Make sure that you don't have 7 people in a waiting room within a foot of each other for 25 minutes waiting to get their haircut. You guys are, I think everybody, I think this has been one of the hardest parts for a lot of people. I think everybody's dying to get a haircut. So I would encourage you guys as you open back up to really be diligent in that scheduling process. I think it'll be better for the customer service aspect of it, but it also will be better for protecting you and staff and the individual, the patrons that come to your establishment. So making sure that we encourage those appointments and making sure that we keep track of all of that stuff as we move forward. Like I said, that's for the contact tracing piece. And then look at your waiting spaces. So at the health department, we have removed the chairs are all spaced 6 foot apart. We don't allow anyone, we don't have any chairs that are set side by side. Making sure that you communicate with your clients and try to make sure that the whole family doesn't show up at one time, or that we don't have a bunch of people sitting around in a waiting room, something like that. Like I said, those are just best practices. Those are what has been defined as best practices. It's going to be up to you as the individual business owner to implement those. So just making sure that we're all doing our part to protect the public and to really eliminate that close contact piece. Fitness centers and health clubs may open, but in-person group classes may not occur, and locker rooms must be closed except as necessary to use the restroom facilities. So with this, I actually reached out to Southwind CrossFit yesterday, and I talked to them about kind of this situation. I know there's a few gym facilities in town that predominantly that is what they do. They have that in-person class situation. Those businesses can open. They just can't have the large class sizes. So what we talked about down there is going to kind of an open gym format, making sure that all of the equipment, and this really goes for all gym owners, making sure that the equipment is spaced appropriately and that we're helping to educate clients as they come in. Again, this is all an attempt to eliminate that person-to-person contact. And then the cleaning piece of it. So any common use surfaces. So in a gym, most everything in there, every flat surface, everything you touch could be a common use surface. So making sure that you follow industry standards and being diligent in having a cleaning process. So making sure that it's at certain times or however you guys plan it or whatever your industry standards are, to go through that facility, clean and disinfect, and make sure that we're looking at any of those common use surfaces. Locker rooms, that type of stuff, like I said, it's you can use them for restroom facilities. Obviously, that's a basic necessity. But trying to keep those congregate gatherings or trying to keep groups of people out of there. So those really all gyms, fitness centers, health clubs, they can open. We just can't have those large groups, those in-person group classes. So however you guys design that within your business to follow that order, it'll allow you to move forward, open your building, just making sure that we're eliminating those person-to-person contacts. In-person commencement and graduations, they can happen. They can happen, but they're very specific about this in-person commencement and graduations in the new order. So no more than 10 individuals in a room, gymnasium, or facility at one time. And then they go on to say even those individuals need to have 6-foot distancing. I see this as basically their attempt to basically prohibit it without prohibiting it. So if you, with your, as far as schools, or if you want to do the commencement or graduation ceremonies, I've talked to the schools yesterday, but I don't think any of them are planning on this, but if any of them are on here, there would be a way to make that happen, but I think it would be very, very tenuous, and it would be difficult to follow the order if you did an in-person indoor type graduation. However, the outdoor graduation ceremonies are also permitted here, as long as there's no more than 10 individuals in the same area or outside of the vehicles. So what they're pushing for here is some type of a drive-through where people would drive up, get out of the car, maybe go up and walk across the stage. You have a couple of administrators up there, and maybe you have less than 10 people. You have that close incidental contact, in that you just kind of pass them by, and so I think that would be a lot easier to maintain and a lot easier to figure out how to comply with the order. So I've spoken with the schools about a few of those. I think we do have a couple of planned for drive-through type setup. Those are allowed under the new order, even with phase 1.5. The bars and nightclubs, unless they're already operating curbside and carry-out service. So bars and nightclubs remain closed in phase 1.5. Unless you've transitioned your business model to be a restaurant type setup, or you're doing that curbside delivery carry-out services, or you are a bar and grill that's already operating that way. So if you're specific standalone bars and nightclubs, those do remain closed in phase 1.5. The theaters, museums, and other indoor leisure spaces, that does include trampoline parks, arcades, and unfortunately the bowling alley. Those remain closed in this phase. I reached out to the bowling alley, spoke with them. I empathize with everyone's position as we move through this. I don't understand the hardship that you guys are going through, but I do understand and recognize the effort that you guys are taking to maintain these governor's executive orders, and I personally thank you for taking those additional steps and walking through this with us. I understand this has been a hard time, and I would encourage anyone who's impacted by this to really reach out to the state and federal level, reach out to their legislators, and make sure they know, make sure they understand your story and how this has impacted you. Making sure that we historically log this, and that we use this to guide future responses. So I do encourage everyone to do that in a professional manner, and making sure that your voice is heard. So those do remain closed. Theaters, museums, and other indoor leisure spaces do remain closed, including the bowling alley, for phase 1.5. Phase 1.5 would last until June 1. My understanding of this is that basically all of the phases just get pushed back 14 days. So we would be looking at a start date for phase 2, which I think everybody was ready for. I'm not sure anybody was ready for phase 1.5, but phase 2 would start on June 1 if everything continues as planned. The licensed child care facilities remain open. They will stay open. The other community centers, so the other list of businesses or buildings that would remain closed is community centers, outdoor and indoor large entertainment venues, fairs, festivals, carnivals, and parades, swimming pools, other than backyard pools. They're very specific about that. So if you've got a backyard pool, I guess you can go ahead and open it. But swimming pools remain closed. Organized sports facilities. This is going to be a big one as we move into summer. I know everybody was really looking forward to getting into baseball practice, getting into summer softball, all that kind of stuff. Moving forward with that, organized sports facilities, sports tournaments, sports games, and sports practices, meaning no team practices regardless of location. All of that stuff stays closed in phase 1.5. So we were all looking forward to that starting, I think, on Monday. It looks like that will be pushed back at least until June 1 at this point. So organized sports facilities, that means no team practices regardless of location in phase 1.5, which is until June 1. Summer camps also remain closed. I don't see specific direction in here. In phase 1, it was summer camps that were part of a licensed childcare facility were okay. I would imagine that would stay the same in that licensed childcare facilities are still remain open. So this would be standalone summer camps would remain closed for phase 1.5. Now, as far as enforcement of this order, so I know there's been some questions. We've seen some things from around the state, or around our own state. We've also seen some Supreme Court rulings, things from outside of the state about enforcement or what enforcement looks like of this. So enforcement of the governor's executive orders is a law enforcement function. So that would fall to the sheriff's department and the police department. The only thing that I encourage everybody to do is comply with the intent of these orders. Do your best to protect the citizens of Ellis County. Do your best to implement the social distancing measures. Do your best to implement the disinfecting, cleaning, hand washing, all of that. Those all impact viral transmission. Those all help to cut down on that viral transmission. They help to keep our populations healthy. They help to keep your work staff healthy. They help us all to be safe. Getting in a legal battle with law enforcement over a nuance of an order doesn't help anybody. So the law enforcement here in town, they've done a great job of enforcing this through education. I would hope that would continue. I've spoken with the sheriff's department specifically yesterday. They plan on continuing through education and really helping business owners to understand this order. If you have specific questions, I encourage you to send us an email at covid-19questions@ellisco.net. We can work through this, or we can work through that together. We can work through those specific questions. But I really encourage business owners to comply with the intent of this order, do their part to continue to positively impact the citizens, do their part to continue to positively impact and limit the amount of viral transmission. We'll all move through this together. I promise we'll get to the other side. It's as we work through it, we're going to learn a lot about ourselves and about our community. And what I've seen so far is that we have a phenomenal community here in Hayes. We have a phenomenal, really network. There's been great support for community engagement. There's been some really neat things that have come from this, and there will be obviously some huge negative impacts from this. But thankfully, those negative impacts haven't come at the cost of lives. The negative impacts haven't come at the cost of large case increases. So we want to keep that as we move forward. I know you can all help in that. I know you guys have helped in that. And I appreciate the hard work, the dedication that you guys have all put into this, and the sacrifices that you've all made as we move forward. So I think I hit everything specifically. I will hit one more time. I beat this drum, I think, from the start, but this is something that I really does impact the viral transmission, is washing your hands frequently. You need to avoid that contact with your eyes, nose, or mouth, like we've talked about. Viruses don't travel well through surfaces. However, if you do take it off, if it is on a surface, you have to transport that, likely on your hands, from the surface to your eyes, nose, or mouth. Gloves. As we look at opening businesses, wearing gloves, wearing the nitrile gloves, those do not help with viral transmission because you can't get it through your hands. What they do is if you wear one pair of gloves and you have multiple contacts with people or you have multiple contacts with surfaces, what you do is you transport the virus by your hands from surface to surface. So washing your hands is far more important outside of a clinical setting than wearing gloves. Gloves are used in a clinical setting to protect you from bloodborne pathogens, so things that can get into your body through your skin. So I don't recommend the use of long-term use of gloves. If you want to use gloves to clean and disinfect, if you're going around the cleaner, some of these cleaners are actually kind of not so great for you either. So if you want to throw on a pair of gloves when you go out and clean and disinfect, and then take those gloves off before you have contact with another surface or another person, that makes sense as far as viral transmission goes. But to just wear one pair of gloves, put them on in the morning, let's say me individually, if I go to Dillon's, if I put on a set of gloves as I walk into Dillon's and I touch the door handle, then I touch the cot, then I touch every single surface in there that I'm looking at, put it back on the shelf, then I touch my credit card, the pin at the front, then I go out to my car, I touch my car door handle, and then I touch my steering wheel, and then I've now transported whatever virus I might have picked up to all of those surfaces by my gloves. So if I would have just went into Dillon's, washed my hands, used some hand cleaner, touched my cart, then when I was coming out, wash my hands, use some hand cleaner before I get in my car, at every point I wash my hands, I cut down the chances of viral transmission. And like I said, you cannot get a virus through your skin. It has to come in through your eyes, nose, or mouth. So cutting down on that transmission is really the important part. So I don't recommend widespread use of gloves. I recommend widespread use of washing your hands and not touching your eyes, nose, or mouth. Remain home if you're sick. If you're sick or running a fever, stay home. That's good year round. That's COVID, no COVID. If you're running a fever or you're sick, stay home. Avoid contact with other people. Isolate yourself to a single room in your house. Avoid contact with your family members, all of that kind of stuff. So that's good year round. Washing your hands is good year round. Let's keep some of these practices in place in Ellis County as we move forward. If you are issued isolation or quarantine orders by my office, follow them. It's the isolation and quarantine order doesn't protect the public. You following that order and minimizing contact with people does. Wearing cloth face masks in public, we talked about this last time. The point of that cloth face mask is if you cannot maintain the social distancing piece, if you think you're going to be in a situation where you're going to be closer than 6 feet for an extended period of time with others, the cloth face mask is a good idea. If you're just going for a walk out in the community or going for a jog, get some fresh air. You don't need the face mask at that point. If you want to toss it in your pocket so you're ready to go, but if you can maintain social distancing, the cloth face mask is not a necessity. It is a recommendation if you're in a position where you can't maintain that 6 foot distance. And then for businesses, there's a link on the governor's website to best practices for businesses. So make sure that you go there. We don't have time to go through all of those nuances. So making sure that you go there, look at that, use your industry standards, and just continue to use best practices, continue to use best judgment. Look around your business, see what you can change, improve, make better, see what you can do to protect not only yourself, but your staff and the patrons of your establishment. We got a couple of minutes here. I went a little longer than I like to. So Sarah, if we've got do you have a couple questions? And then, like I said, I encourage everybody to reach out or follow us on Facebook. We do provide quite a bit of information on there. Also on our website, we have quite a bit of information. And then there's obviously the KDHE website and the governor's website. And if you can't find any information on those four, you can always send us an email, or if you have specific questions, send us an email and we'll do what we can to get back to you.
So Jason, we do have some questions for you. Tanning salons weren't necessarily pointed out. Are they included in the groups that are allowed to open on May 18th?
Yes, so they are, they fall under, and it actually does specifically say nail salons, barbershops, hair salons, tanning salons, tattoo parlors, and other personal services. So every business that was closed outside of really the theaters, museums, the bars and nightclubs. As far as specific businesses, those are open. So the nail salons, barbershops, hair salons, tanning salons, tattoo parlors, and then the gyms and health clubs can open, but they can't have the in-person classes.
Okay. And then one other question. We know that based off of what you're saying, the answer to this question is likely yes, but should salons, the employees that work there, should they be wearing masks while they're servicing their customers?
So that is something that they really need to follow their industry standards on. I'm sure there is some industry standards or guidance for them, but the CDC and the KDHE do recommend that if you cannot maintain social distancing, if you can't be 6 feet away if you're going to be within 6 feet for an extended period of time, they recommend the use of masks. Now, if in a salon or something like that, if you're going to have that close contact, it would be up to both people really to wear a mask if we wanted the maximum level of protection, making sure that we are washing our hands and not touching our eyes, nose, and mouth, and then cutting down on that viral load. So as people talk, as people breathe, there is a possibility that the virus does for a short period of time become airborne. That's how it transmits. So that mask kind of helps cut down on that airborne transmission.
Very good. And then one other question, if a sports team is not considered an officially organized group, such as traveling teams, are they able to practice and play games right now?
So as of, let me find the specific language for you.
And I don't want to assume that this is what they're meaning, but if, a family group of a couple of cousins or whatever would want to get together, my best guess is that's where this is coming from.
So in this order, it's not specifically mentioned. And like I said, now I will tell you, this is not a signed order. I have not seen the executive order at this point. There could be some verbiage that changes. And then I would assume sometime next week, we'll get some FAQ documents that further refine this after the questions come up. But at this point today, it is not specific as to what type of group. It says organized sports facilities, sports tournaments, sports games, and sports practices, meaning no team practices regardless of location. So if you don't meet those criteria, Ellis County has not issued any more restrictive orders. So if you are not in the organized sports group, you don't meet the executive order, then it is not prohibited.
Thank you. And then another question came up. Does this change the swimming pool being able to open in June?
So this, I don't know about June. I don't even know about Monday, to tell you the truth. Like I said, this is not a signed order. So we're getting through this as we can. But as of right now, the swimming pools are closed until June 1 if phase 1.5 goes into effect. So I'm sorry for the political answer and dancing around that one, but I as of right now, it looks like June 1 would be the date that phase 2 would go into effect. So then we would follow the phase 2 guidelines.
Thank you very much. It looks like that is all the questions that we have for right now. I know we have about a minute delay, Jason, on our feed right here versus what folks at home are seeing on YouTube. So if there aren't any other questions, we can kind of get finished with this morning. Until we kind of go through that minute, are there any other announcements or things that people should know? Will we be sharing more resources? I know you'd mentioned the FAQ document when that becomes available. If you would want to send that to me, we could definitely put that on our chamber website for people to access.
Sure, absolutely. We'll try to get as much information out as soon as possible. I would encourage everybody to check our Facebook page, to check our website, to check the governor's website, and then the KDHE website. The last thing to talk about that I kind of forgot, there will still be a travel restriction or non-essential travel is still discouraged with the phase 1.5. They have changed the travel restrictions. I would encourage everybody to go to KDHE's website. On the left-hand side, there's a big link to KDHE travel restrictions. There are certain states have come out. I know Colorado came out of the travel restrictions on the 12th. So making sure that you stay up to date with that mandated travel restriction. And what that means is if you travel to a state that is listed or come from a state that is listed, you would be a mandatory 14-day quarantine, at home 14-day quarantine. So making sure that that you're checking on that information, we'll try to keep that up to date as well.
Thank you so much. Just a few comments of appreciation for your ability to meet with us on a weekly basis, Jason. We truly appreciate your time and want to say thank you for everything that you're doing to keep our residents safe in Ellis County.
No problem. Hey, it's this is our primary function. It truly is. We're blessed with a great community. Thankfully, we've had extremely low numbers. We've been able to get through these first couple of months safely. So stay the course with the social distancing, that 6 foot, making sure that we're washing our hands, not touching your eyes, nose, or mouth. Those are still best practices. They've been best practices from the start. Continue those. We'll move forward safely, and we'll see in a couple weeks, maybe. I don't know. We'll keep you updated if we need to do another one of these. If something changes, I would encourage you, like I said, follow us on Facebook. If something changes with phase 1.5 or something looks different, we'll make sure to get the information out to the public.
Thank you, Jason. And the Chamber would also like to take a moment to thank Nex-Tech for providing the technology for all of these meetings on a weekly basis. And thank you to everybody for logging in this morning. We will be updating our website at hayeschamber.com /news-announcements as we get further information on the plan as it rolls out. So again, thank you, Jason. We wish everybody health and happiness and hope you have a great weekend. Thanks for joining.
Have a great weekend.